Okay, Sierra comes to the clinic with a chief complaint of, I am ready for my next step of my cancer care. Sierra is a 60-year-old Caucasian female who is postmenopausal, diagnosed with early-stage non-metastatic breast cancer that was ER/PR positive and HER2 negative. She got a chemotherapy treatment of doxorubicin, cyclophosphamide for 4 cycles, followed by paclitaxel. Her past medical history includes breast cancer, ER/PR positive, HER2 negative, hypertension, deep vein thrombosis, depression, and she also got a lumpectomy in November 2018. Family history: mother also had breast cancer. Social history: she's a non-smoker. She drinks 4 glasses of wine a week. She denies any illicit drug use, and she has 3 grown children. For her medications, she currently takes fluoxetine 40 milligrams by mouth daily and amlodipine 10 milligrams by mouth daily for her blood pressure. The fluoxetine was for the depression, and she previously completed her chemotherapy regimen of doxorubicin 100 milligrams, cyclophosphamide 1,000 milligrams, and paclitaxel 150 milligrams. She has no known allergies. All her immunizations are to date. Her review systems: she was positive for arthritis and myalgia. She was positive for fatigue, but was negative for any rash, chills, or malaise. Her vital signs are as follows. Her blood pressure was 128/74. Heart rate was 74. Her temperature was 98.8. Her respiratory rates were 16. She is 66 inches tall, which is 167.64 centimeters. She weighs 136 pounds, which is 61.81 kilograms. Her BMI was 22, and her BSA is 1.7. Laboratory and diagnostic tests: her platelets were at 300,000. Her white blood cells were at 3,500 cells per milliliter, which was a little low. Serum creatinine was 0.9. Creatinine clearance is 65 milliliters per minute. And the tumor was ER/PR positive, HER2 negative, and she also has an ejection fraction of 55%. So the patient's problem: she is just ready to start. She's ready for hormonal therapy. So based on the NCCN guidelines for invasive breast cancer, I recommend starting this patient on anastrozole for her hormonal therapy for 5 years. And anastrozole, because she is postmenopausal and she had non-metastatic breast cancer that was ER/PR positive and HER2 negative. So my goals for this patient are: we want to decrease her breast cancer symptoms, extend and increase her quality of life, minimize any adverse drug reactions or drug interactions, and prevent disease recurrence. So my drug recommendation will be anastrozole 1 milligram by mouth once daily for 5 years. For her safety monitoring, we'll monitor for any adverse effects. One of the main ones is hot flashes. We need to monitor her LDL and cholesterol per leg count, and also her bone mineral density. And then for efficacy improvement, we just want to monitor that there is no reoccurrence of the cancer.